Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tinnitus, or tinnitus, I guess is also correct pronunciation, also ringing in the ears. It's a sensation of hearing a sound when there isn't any sound. It's often described as a ringing, a buzzing, humming, tweeting, or pulsing sound in the ears. And you may hear it in one or both ears, and the sound can be present all the time, or it can come and go.
In most cases, tinnitus, I got to figure out which one I'm going to go with. It can be managed, but for some, it's a chronic condition that can affect sleep and everyday function. Fortunately, there are options to reduce its effects. And here to talk about tinnitus and how it can be treated is Dr. Gayla Poling. Dr. Poling is the Director of Adult and Pediatric Diagnostics in Audiology at Mayo Clinic. Welcome back to the program. It's good to see you, Dr. Poling.
Yeah, thank you for having me.
Dr. Poling, nice to have you. So this is a pretty common problem, tinnitus, ringing in the ears.
Yeah, it's very common. Over 50 million Americans actually have some form of tinnitus or tinnitus. Of those, about maybe 20 million or so have chronic tinnitus or something that's more noticeable or bothersome. Of those, even a smaller percentage, more like 2 million, have tinnitus that is so debilitating that it's hard to function in daily life.
Why is it? What causes it?
That's a great question. We have many
I've
brilliant.
You
tricked me already, but millions of people are working on this across the world right now because it is such a big problem. We think that there's some connection with hearing loss. Over 90% of those who have tinnitus have a noise-induced hearing loss or some age-related hearing loss associated with it. So that's number one, what we try to address.
And does it progress if I notice it in the morning when I wake up, but I don't really notice it the rest of the day? Is it there and I'm just not noticing it? And will it get worse?
Those are all great questions as well. We know there's a strong connection between stress and the perception of tinnitus or ringing.
Really?
So the more exhausted you are or the more stressed you are, you might perceive it more. Mm-hmm. Also, the less distractions you have around you in this really noisy world, the more noticeable it is. So that's why you notice it probably mostly at nighttime.
Mm-hmm.
Are there some medications that can cause tinnitus?
Tinnitus is a common side effect of a lot of medications that are out there. So if you have those concerns, it is best to bring it up to your physician.
And what about blood vessel problems? Aren't there certain kinds of blood vessel problems that can contribute or cause tinnitus also?
Oh, certainly. A percentage of those with tinnitus can be linked back to a medical concern or issue.
So when you see a new patient with tinnitus, what's the workup involve?
Sure. We always start with a hearing test to start out with, since such a majority of those with tinnitus have some type of hearing loss associated with it. So we start with a hearing evaluation, and then we often will loop in a medical colleague, like a physician, to evaluate the medical comorbidities that might contribute to it.
Would that involve potential imaging of the brain or the spine or the mouth area?
Absolutely. It could lead to that. Initially, what you're talking about is just coming in for a more traditional hearing test where you're putting headphones on and you're listening to sounds and we're measuring how soft you can hear at different frequencies or pitches.
Do you have tinnitus in both ears, or can you just get it in one, or is it even?
It's all of the above.
Okay.
So it can be 1 year. It can be just, a brief moment in time. It can be constant or sort of consistent and, like you said, more noticeable over time as well. It's more the constant tinnitus that stays there and doesn't go away that we want you to get evaluated.
All right, so let's talk about treatment. I assume that if it's medication related, you would change the medication. If there's a blood vessel problem associated with this or causing it, that might be amenable to some different kind of treatment. What about earwax? Do you start there? I mean, can too much earwax be a cause of tinnitus?
I wouldn't call it a cause of tinnitus, but it might make it most noticeable. So if you think about plugging up your ears, now all of a sudden that internal noise in your head is now louder, and that's what you can hear. So certainly looking in the ears and cleaning out any earwax is typically the first place we start. But if it is something medically related, there are lots of different treatment options that way. The majority of these cases are not, there isn't a medical cause for the tinnitus that's treatable. So then we start talking about amplification or hearing aids.
I just want to know more about the stress-related piece of it. That surprised me, because I know I've heard, there's products available to help you not notice the tinnitus. So I imagine that's like a training that you do, like a meditation or some sort of something along those lines. Is that what's happening when people say you can train your brain to not notice the tinnitus?
Absolutely. Some of it is just sort of masking the tinnitus or making it less noticeable. So it could be introducing a fan noise as you're going to sleep, so you can focus on the fan noise rather than the tinnitus or ringing in your ears. There are actual therapies that are out there to, like you're saying, train the brain to make it less noticeable. And then also, like I said, stress can introduce a lot of complexities in your daily life anyway. So we do find that it's not necessarily stress causes tinnitus, but we know that there's a strong correlation there. So reducing the stress does reduce the perception of tinnitus.
So you talked about a white noise machine. That's what people would use at night, not necessarily during the day, though.
In some cases, people do find relief from using that during the day.
All right, and then there's this program called Tinnitus Retraining, right? Is that what you and Tracy were just talking about?
That's a version. Yeah, that's one of the options.
And how does that work?
So that's called Tinnitus Retraining Therapy, or TRT. That's sort of a similar approach where you, over time, sort of condition yourself to focus less on that ringing sound and more on a noise of some kind or another sound, distracting noise, which could be a white noise or it could be something similar to that.
And then you mentioned hearing aids.
That's what I was just going to ask about. Yeah, why do I want to put hearing aids in? If I've got ringing in my ears, wouldn't that make it worse?
That is so counterintuitive. When you think about 90% of those with tinnitus have hearing loss, the hearing loss piece is what's actually the part that you can manage. Mm-hmm. So when you put the hearing aids in, you can now make sounds in your environment more audible, so you can focus on the world around you rather than that noise or ringing in your ears. So it just sort of makes it less distracting.
That makes so much sense, but on the surface when you say it didn't make sense at all. So again, hearing aids in both ears or just one ear? What usually works best for patients?
Most people have hearing loss in both ears, so they're typically talking about hearing aids in both ears. But some people only have hearing loss in one ear, and sometimes only tinnitus in one ear, so that might be the appropriate path.
What about medications? Are there any medications that are helpful?
There's no scientifically proven known medication that treats tinnitus.
All right, what about what we see on TV, not infrequently, is an ad for lipoflavonoid. And it says on the bottle, the #1 ENT doctor recommended for tinnitus. Does it work?
We do see those a lot. I have not seen any scientific evidence to show that those are anything more than a placebo, but that is something that is constantly a focus and interest.
But the crazy thing about placebos is that if they work, it works.
Yeah.
And if the thing would be, though, is if this medication is harmful, I mean, you don't want that. But
absolutely.
I can totally see if taking this pill makes that ringing in your head go away, why would it be harmful?
Absolutely. And there's all types of solutions and treatments on the table until we really know what the true underlying cause is. So as we advance the research and find out those specific causes, then we can better improve on the treatment. But always check with your physician before starting any sort of supplemental treatment.
So how is the research going on tinnitus? I mean, is there any bright spot on the horizon?
I think there are lots of exciting opportunities now. As we advance our clinical tools, we're also getting more individuals who want to know the answer why. So the more we learn and the more people volunteer for research, it's really helping us.
And don't forget about the placebo effect, 30%. So 30% of people get better or think they're better just by taking the medication, even if it's a sugar pill.
I love it.
It's truly
If it works,
interesting.
I'll take it.
We've been talking about tinnitus or ringing in the ears with a Mayo Clinic expert, Dr. Gayla Poling. Time for a short break. When we come back, we'll talk about age-related hearing loss and what can be done about it. Plus, we'll get a myth or matter of fact.
That's right. Myth or matter of fact, hearing loss can affect your overall health.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are back talking with audiologist Dr. Gayla Poling. And we're here this segment, to talk about the common problem of age-related hearing loss, also known as presbycusis. But first, Dr. Poling, myth or matter of fact?
Presbycusis?
Presbycusis.
What the?
You learn a lot of words on this show.
I do. Myth or matter of fact, does hearing loss affect our overall health? Is that true? Is that a fact or is that a myth?
I think it's a little bit of both, right? Hearing is part of our everyday health function. So certainly things that impact our overall health impact hearing. And certainly we've just talked about how stress and hearing loss can contribute to stress. All that can impact our overall health as well.
So I guess as we age, just like everything else, our brain or our ear wears out also, right? It makes it more difficult to hear because it's an extremely common problem.
It is. I mean, our ears are on 24/7, 7 days a week, our entire life. Even at night when we're sleeping, they're doing work. So they never really get a break. So there is a certain amount of wear and tear over time. There are certain things that we do throughout our lifespan to sort of accelerate that wear and tear. So think about the more you use your ears and maybe they're working harder around noisier sounds early on in life, that might mean that age-related hearing loss comes on a little sooner for you.
And what is it that wears out? Is it what's in the middle ear or the inner ear or the nerve to the brain, or what goes wrong?
Right. The majority of what we're talking about with age-related hearing loss is hearing loss in the inner ear. So it's actually the small internal delicate structures within the inner ear that wear and tear over time.
The hammer, the anvil, and the stapes?
Nope, the hair cells. So
inside, way inside.
Way inside.
Okay.
And then the same thing wears out if we had a noise trauma or some sort of loud sound that we were exposed to. Those delicate structures get damaged and they don't regenerate or grow back over time.
No matter what age you are?
No matter what age you are.
All right, who's at risk? I know one thing, it's more common in males than females, isn't it?
Yes, and it's more common later, the older you are.
So age is a factor. Loud noise exposure?
Yep, so if you're more exposed to loud noises, and also just we're learning a lot about genetic factors. Some people just seem to be more predisposed to hearing loss than others.
Family history?
Yeah.
All right, what about diabetes and smoking?
Yep, those are also associated with increased risk of hearing loss.
And heart disease?
Same thing, also.
Wow.
It's all interconnected.
And radiation? Prior radiation for head and neck cancer
yep,
can
it
affect
can.
your hearing, can't you?
Medication exposure, so certain types of chemotherapies and things like that can also accelerate age-related hearing loss.
Does the radiation exposure have to be to the ear? Does it have to be to those little hairs, or can it be anywhere in your body?
That's a great question. It tends to be to the head and neck.
Mm-hmm.
Right, for head and neck cancers or something like that, and then it might end up being only one-sided. But if you've had prior radiation to the head and neck, certainly a risk factor.
When it comes to loud noises, I mean, now I'm worried about the teenagers at my house that they've got their earbuds in. When I was a teenager, I was going to rock and roll shows, and I'm sure you were like, your mom's like, you're going to lose your hearing. Is there any way that we can fix any of that damage that's been happened because of that? It's unfortunate that the message doesn't get through our thick skulls when we're younger, or even now,
right?
That we should be treating our hearing a little more delicately.
Absolutely. We certainly know more now than we did then, so to speak. So there's no current cure or magic fix for that. The best fix is to prevent it from happening in the first place. But now that we know that that does happen and that does show up later in life, we are better about more health, public health campaigns to really talk about how loud the sounds are and for how long. Your ears are meant to be used, so you shouldn't stop experiencing and enjoying life because of that. It's just about moderation and wearing hearing protection if you're going to be standing next to a speaker at a rock concert.
Well, I think you said that you have tractor-related hearing loss because you grew up on the farm.
Yeah.
I have lawnmower-related hearing loss.
Right.
And then the kids today have those earbuds or whatever and it's loud. And so that's going to be the next problem.
But also, I would love to know if you've noticed this. Kids today maybe are wearing ear protection more often too. I know I've got a kid who's in the marching band, and all of those drummers wear earplugs when the band is performing, and they've got fancier ear protection, I guess you'd call it. Does it make a difference if I'm just using the little piece of foam earplugs, or should I be investing in a good set of earplugs for ear protection?
Custom made.
Absolutely. It depends on what your noise exposures are. So for musicians, having a foam earplug that just turns everything down doesn't necessarily help the music quality. So they're investing in more custom hearing protection for a musician, so it's only canceling out those really damaging pitches or damaging sounds. That can be really beneficial. But for other things like mowing the lawn or you're out on the tractor, you want as much protection as you can because you just want to bring the whole loudness level down. And those are more like the foam earplugs or the over-the-ear hearing protectors.
What are things, I think people are surprised to hear that a lawnmower can be something that's damaging. I mean, what are some of the unknown hearing damage that people might experience?
One of the biggest things that we experience in the clinic with people with using lawnmowers is they might be using maybe a personal music player, playing that in their ears and turning it up loud enough to hear it over the noise of the lawnmower. So now you're making that sound that was already loud even louder, and it's even closer to the inner ear, which is the part that you can damage. So in those cases, I would recommend people invest in earmuffs or hearing protection that actually plays music too, so you can cancel out the dangerous noise and actually enjoy your music.
All right, talk to us about hearing aids. They're good sometimes, but they're not great, are they?
They don't solve the damage itself, right? It's sort of like putting on eyeglasses. It doesn't fix the underlying damage. So depending on where that damage is, if it's in the inner ear or more in the nerve, they might not be as beneficial for some people as others.
And can you go, is it important to go to an audiologist to pick out a hearing aid or have them help you pick out a hearing aid?
Absolutely. Your journey starts with a really thorough diagnostic evaluation by an audiologist. They can not only determine what type of damage or help determine what type of damage you're experiencing with your hearing, they can help guide you to the most appropriate solution for managing that.
And the cost. And what's the difference between a regular hearing aid and a digital hearing aid?
So we're fortunate today that everything's digital. And with the advances in technologies that we see all around us with cell phones and special devices that you can communicate on, all of that has made hearing aids much more accessible and the technology much more accessible. So I would say that all of them are digital now, but you can get sort of the Cadillac model or the most basic entry. And it really depends on your hearing loss, what you need.
And what does digital really mean?
Digital just means that we can control the parameters enough that we can really optimize the hearing aids to suit your hearing loss.
Okay, so based on my audiogram, what the range where I have difficulty hearing, and then you can adjust the digital hearing aid to maximize my ability to hear in that particular range.
Absolutely. So depending on the period or time in your life or even the type of hearing loss you have, there might be things that just making everything louder is helpful for you. Those are more assisted listening devices. So that's a little different than a hearing aid that's more personalized.
And what is the research that's being done on hearing loss? I mean, we talked about tinnitus. Anything else you want to share?
Sure. We're spending a lot of our time and effort on looking at new and improved diagnostic tools to really detect what the exact cause of the hearing loss is. We know those delicate structures in the inner ear are a source of wear and tear, but they're also the earliest indicator of change. So now we're looking at that in a more preventative hearing healthcare model where we can detect those changes earlier in life and maybe tie them into prevention.
All right, thanks so much, Dr. Poling, for teaching us so much about tinnitus, ringing in the ears, and also age-related hearing loss. We appreciate it. Dr. Gayla Poling is the Director of Adult and Pediatric Diagnostics in Audiology at Mayo Clinic. Thanks so much for being with us.
Thank you.